first of all, thank you for having a chat with us, Peter, and talking about these things that I know you are very well versed on. I wanted to start, you've been paying attention to the state of public discourse for years. I'm curious as to how you would characterise it today.
The whole character of the public discourse, the public conversation has changed. And of course, it's changed with social media particularly. And also, it's become more polarised. Some of us look back to an era where Australia and the world in general, I think, embraced a more collective view that everyone deserved a fair go. That's been greatly eroded, not so much in Australia as in the United States, but it's much less than it was.
One group we perhaps don't talk enough about is the vaccine hesitant. How would you describe them, and how can we better reach them with our public health messaging?
I think vaccine hesitancy is very understandable. Vaccination is a medical procedure. There's no medical procedure without some risk, and that's certainly true of vaccination. And what we saw through COVID-19 was that the new vaccines that were brought in very quickly, and I think did save a lot of lives, actually weren't tolerated particularly well by a number of people. It's certainly true. Older women were hit by the vaccine that was made here initially by CSL, the one that came out of Britain, and adenovirus vectored vaccine, and several died. And that vaccine was quickly withdrawn. But then the mRNA vaccines were causing considerable distress, particularly to adolescent males. And a number of kids went into hospital with myocarditis, and there has, I think, been some permanent damage. So it's quite understandable, and it's always a risk-benefit equation. How do you win people's trust back? You try to point to the evidence, and the evidence is that the vaccines of childhood, the standard vaccines of childhood, are really extremely well tolerated, and they're safe and effective, and yet there's enormous pressure against those. That's the gold standard, really. We need to get our kids vaccinated with those vaccines of childhood.
There seems to be more bugs around these days. Are we seeing humans at a greater risk of disease, be that viral, inflammatory, or even rising rates of cancer? And how can we best respond to that?
But the fact that rates of cancer are on the rise may just be because we're living longer. The perception there are more bugs around. There's probably not more around, but there's a hell of a lot more people. If you look at the world in 1900, there were 1.6 billion people. Now there are 8 billion people. And a lot of those people are in Africa, and they're coming in contact more and more with wildlife. And part of the reason for that is the food situation in Africa is getting steadily worse due to climate change and various factors like wars. And people are going to the jungle to harvest, say, bushmeat and so forth. So there's the danger of viruses jumping across. This is certainly the case with Ebola. We just saw a case. There's a new virus that emerged in the Congo. It appeared first in 3 children who died after eating a bat. The other thing that's happened with influenza is after the Second World War, the US and Australia particularly got together to try and improve food security in East Asia, particularly in China, and help them build massive chicken industries. And these birds are multiplying influenza viruses and getting them across into people. So there's a much greater risk from influenza. Then, of course, there are the live animal markets, and with many more people, they become more dangerous. And then above everything else, there's long-distance planes and mass international tourism. Changing human behaviour is complex. I think what governments need to do is they need to keep their public health agencies strong and on the ball. And the recent firing a lot of people from the CDC, which is the premier agency in the US, of course, has been deeply disturbing. I believe 5,000 of them are now back at work. I mean, this is what's happening. The US is in total chaos. I mean, President Trump is a chaos generator. So public health agencies need to be strong. People need to be aware of them, and unfortunately, the COVID-19 experience led to a lot of disillusion on various people's parts, a lot of which was fed online, of course. If we ever get a serious disease, I mean, COVID wasn't as serious as it could have been, but in 1918-19, with the influenza pandemic, with maybe a quarter the size of the population we've got now, 50 to 100 million people died. Now, if we get a virus like that back again, I hope we can persuade people to actually listen to public health measures, because initially that may be all we've got.